Well, at the start of this year, the CDC changed the U.S. childhood vaccine schedule, reducing the number of recommended vaccines for kids. So what do parents need to know? Here to break it all down for us, 2822's Paula Giangiacomo with tonight's Paula's Parenting Playbook.
Hi, Nick. Big changes have been announced recently regarding childhood vaccines. The new U.S. childhood vaccine schedule released at the beginning of this year reduced the number of universally recommended childhood vaccines from 17 to 11. 6 vaccines have now shifted to shared clinical decision making, a move that has sparked debate and pushback from some doctors.
Matt Spott of Carbondale brought his 3-year-old daughter Cecilia to Main Street Pediatrics in South Abington Township for a sick visit. He says when it comes to medical decisions for his 3 children, he follows the trust and guidance of their pediatrician.
I'm always going to put my faith in the doctor that I'm choosing to see.
The physician caring for his children is Dr. Anders Nelson. He has been practicing medicine in northeastern Pennsylvania for 35 years and has previously served on the board of the National Foundation for Infectious Diseases. Dr. Nelson says he does not support the CDC's recent changes to the hepatitis B vaccine recommendation.
The recommendation from the CDC is that it occur at 2 months, 4 months, and 6 months, which is contrary to what the American Academy of Pediatrics wishes to do, which is to continue the birth 2 months and 4 months and 6 months. It should be still a recommended vaccine at birth.
This is hepatitis A.
The CDC's Advisory Committee on Immunization Practices says healthy infants who test negative for hepatitis B no longer need the birth dose. The CDC has also dropped its recommendation for hepatitis A, flu, rotavirus, RSV, meningococcal meningitis, and COVID vaccines. These changes are part of the Health and Human Services initiative, Make America Healthy Again.
The COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
In addition, the HPV vaccine schedule has been reduced from 2 doses to 1. The new immunization schedule focuses on these core vaccines. While all vaccines remain available and covered by insurance, the total number of childhood vaccines has decreased from 17 to 11.
The CDC is reducing the number of recommended vaccines for children to give parents more flexibility and choices. But Dr. Nelson opposes those changes, saying they're risky. Dr. Nelson will continue to follow the recommendations by the American Academy of Pediatrics.
So what does this mean for parents? It means conversations matter more than ever. Parents are encouraged to talk with their pediatrician to decide what's right for their children, something this father of 3 already does.
I don't want opinions coming from the government. I want opinions coming from experts. I want people with medical degrees making the decisions that are best for my children.
The new immunization recommendations are based on a 33-page assessment comparing the U.S. schedule to Denmark's. The changes have been applauded by some who welcome parental choice and worry about vaccine safety. Meanwhile, a coalition of medical groups have expanded an ongoing lawsuit against Secretary Robert F. Kennedy Jr. to challenge and reverse the reductions. The new changes to the schedule. Secretary Kennedy has also proposed a major overhaul of the vaccine injury compensation program, claiming the system fails to adequately compensate individuals who've been injured by vaccines. Now, for more information about childhood vaccines, go to our website, 2822news.com, and click on the tab Paula's Parenting Playbook. Nick?
Nice.